So I'll ask my dummy for the day, Mr. Lawrence, to come so that I can demonstrate. So we can have somebody assisting with exercise on the muscles, or just therapy by first of all determining the area of the pain, and then on that particular area we apply pressure. So this is actually borrowed from what we call as acupressure, which was a practice that was done by the Chinese in the ancient times, and it was shown to have helped. So pressure on the particular area of the back, mostly done by the chiropractors, but can also be done at home. On this particular issue, you can also apply what we call as the non-steroidal anti-inflammatory drugs that are in form of a gel as you do the massage. Okay, and then just stand up. Then there are those activities that you do apart from this. Okay, so just come on the knees. You can do this by your own, and then overstretch without hurting the back. Okay, as you exert more pressure on the low back, this helps to relieve some of this pain because of the pressure. And then we have you can lie on your back, and then your knees on the chest. Take your knees to the chest and then hold them tighter. Okay, yeah, that also helps to relieve some of this pressure. And then of course the yoga. Thank you, Mr. Lawrence. So this physiotherapy can be done by a professional, or the people that we call as chiropractors. We also have heat therapy or cold therapy. Heat therapy is meant to relieve the pain by that kind of soothing effect. So if you can also have the cold therapy by having very cold. You can have cold bags like what ladies normally use during dysmenorrhea. So you can have those cold bags that normally relieves pain by the dullness effect to the pain on the back. Okay, and then if the pain does not go away, then we have muscle relaxants that can be used. Simple muscle relaxants which are available in hospitals that can be prescribed by your doctor. An example is what we call as Flexlor, we have Loxiams, MR, we have Dolomed MR, among others. We also have non-steroidal anti-inflammatory drugs because the low back pain will definitely present with some kind of inflammation depending on the cause. So diclofenac, aceclofenac, if the patient has no other gastric pathologies, can also be given this kind of analgesics. Then if this pain is persistent or not responding to all these forms of treatment, then we consider what we call as epidural injections, which can be done by orthopedic surgeons, can be followed up. These epidural injections are also just anti-inflammatory, or the steroids like dexamethasone, which can be given specifically for causes like sciatica. Sciatica happens when we have a disc prolapse or a disc herniation causing nerve entrapment syndrome, which will cause pain on a unilateral aspect of the limb. So if that doesn't go away, then after some of these radiological investigations like an MRI, CT scan showing probably reduction in the vertebral spaces, then we may need to do what we call as a decompression surgery. Again, not all these surgeries will be effective or will relieve the pain completely, but we have a series of follow-ups with other physiotherapy activities that will help the patient to get back to normal. So relieving of low back pain is just an easy thing to do by what we do in the day-to-day practices. As I said, the pains are now on the high because of how we sit, because of our activities. Some people have been working from home, sitting on the computer for a long time, so that can definitely predispose you to low back pain. So I'm going to practice or to show you on the kind of appropriate chairs that we need in offices. Mine may not be the most appropriate chair, but first of all, you need to work in a comfortable position, the height depending on your table. So some of these chairs can be mobile. So depending on your position of the table, you can take it low or up. And then such kind of chairs are recommended for people who work in office, sitting down for a long time, because it's trying to take the posture of a back. You can see this anterior or forward curvature of this kind of a chair, which helps to relax the back. Okay, and of course where you sit on should also be comfortable, rather than sitting on the plastic or wooden chairs that will cause pressure for a long time. And then of course, while working, you should not be seated for the entire part of the day. At some point you should be able to stand, have a walk, and then get back, so that you do not also become a patient. Whether you are a healthcare giver seeing patients, you should be able to change some of these positions. And for the long distance drivers, some of them have also developed changes on the kind of seats that they have, and then of course the distance to the steering, so that it's in a comfortable position because of the long hours of drive that is expected. Some of them could drive for more than 10 hours, and if you do that on a day-to-day basis, definitely you are going to hurt your back. So make sure that what is comfortable for you is workable for you. And for the heavyweight lifters or any other manual duties, you should be able to use the appropriate weight, what is comfortable for you without hurting the back. How are we supposed to lift the weights? I'm going to demonstrate on how to lift weights. People work in warehouses, people who carry cements, people who do heavy manual duties or carry heavy materials, you are not supposed to go just like this by bending over. That means that you overstrain and overstretch your muscles. So just go in this position, assume the normal posture of the position, and this means that should be something that should be able to be carried so easily, okay, without hurting the back. So some of this, and of course for sports activities, do what you think is good for you. Avoid some of these risky activities that can predispose you to trauma that will result to injuries on the back. So these are some of the simple things that we can do to help us prevent or reduce the risk for low back pains. And in case low back pains happens, then of course what we've said as a simple massage therapy, heat therapy, cold therapy, non-steroidal anti-inflammatory drugs, muscle relaxants, or if for the worst case scenario, then of course you should be seen by an orthopedic surgeon for a possible epidural injection or a decompression surgery. Thank you.